did strongman. I did every known to man to be better. I never used steroids. I never did any test boosters, never did anything. I finally became a GM of a gym, and one day I just realized there's something wrong. I wasn't able to focus. Things that I usually never let slip were slipping through the wayside. I wasn't holding my team accountable. I was having negative thoughts, wondering what's even the point. I would work out for 10 minutes and realize, what's the point? I'm just gonna get distracted and I would stop. This was my life since I was 14 years old. I'm now 34, 33. I don't know, once you get past 25, you kind of forget. So I stepped down. I went to the owners and said, hey, the gym is failing. Like, I don't know why. Like, I trained the next person and I got recruited to work here. Again, I'm from the Midwest. The only thing we knew about that was libido. If you have low testosterone, you are not a man. If you have low testosterone, then you can't get it up. You know, that's literally what my friends still talk about, jokingly. When I say, hey, joke's on you, I feel fantastic. But, so I got recruited to work for Ageless, and there's a PowerPoint slideshow that said all the signs and symptoms, everything I had. I just thought it was pure depression. And I was like, there was something wrong with me. But I was able to kind of think back as to why this may have happened. The day I got promoted to GM, Monday, March 18th, I believe it was, 2 hours later, COVID, shut down everything. Finally got my dream job, COVID happened, cool. So if COVID happened because of that and wasn't meant to be, I'm sorry, I take responsibility. But, and then cross country move, and then getting engaged, getting married, all these different life factors were taking a toll. And so it's not just bias towards your age, towards like what you do. Because we have some of the strongest people that have never used, some of the healthiest people that need testosterone replacement therapy because, again, high stress, especially former military. Majority of our people are former military, especially in this area, right? So it is a taboo topic in so many different areas, and that's why I'm here, just to spread awareness that it is okay. That even if you feel like you're not affected, like you should still be able to get tested so you have a baseline. So if something happens 5, 6 years down the road, you're not sitting there wondering, why do I have these negative thoughts? Is it depression? Why am I not same as I used to be? Why am I, what I like to say is, why am I tired of being tired? Why am I reactive, not proactive? It all could be because of that hormone balance. You know, body craves homeostasis. That's how it runs the most efficiently. Y'all are nurses. I know that word. I remember. When we have that balance, that's when everything runs efficient. Now, before, I didn't get started right away, just because, again, I was more worried about what my friends would think. You know, I'm not one to like lie. I'm like, again, if I did a complete body change, I'd be like, hey Joey, what happened? Again, sorry, don't worry about that. But when I would ask people, because we have people from low to mid 20s, all the way up to 65, 70. Like, I asked their why. Why did they get started? What was it? One story in particular really got to me. He started when he was 25. Very good kid, like very good dude. Very successful job. He just had a family, like me and him got really close. And he said that he was having these same signs and symptoms when he was 23. And he just went to a doctor and they just wouldn't even like give him the time of day to look at hormone levels. Like, no, you're too young, you don't need it. Too young, you don't need it. They just want to throw antidepressants on him, and he didn't want to be on that for the rest of his life. Then he got started. And he said literally after 1 month, he started feeling better. 2 months amazing, and he said that he'll never stop because it's been more beneficial to him, his life, and his life with his relationships. It's not just from a standpoint. And I was like, okay, that's a really good story. Other people would be, they are losing focus at work. Some of them say it is a libido thing, but not necessarily the libido thing that you would think of. In terms of, they did not have a good relationship with their partner. They were too tired throughout the day. Like, if you're putting all your energy into your job, when you get home, you don't want to give your partner the time of day. Like, they're talking, but are you actively listening? It can help that balance of helping relationships with your significant other, which then can lead to the libido aspects. I never thought libido was an issue for me. That's why I never made it a point to get tested. Never thought it was gonna be a problem. Didn't know, absolutely. Didn't know it was a problem, no. It wasn't, but didn't know. So, again, it is not age specific. And even if you've never had your level tested, which I know a lot of people haven't, because doctors don't actively ask you what you're on. They just do the basic health panels. Oh, you're fine, we'll talk later. Hey, can you test my testosterone? Why? You don't need it, we'll talk later. We've had so many people come to us, like mid-40s, and they say, hey, until you're 60, we're not gonna manage it. Why? And like, don't get me wrong, it's not a bad thing. Like, if you're 60 plus, you can still feel great on it. Like, it's just a health of the lifestyle. But you have to really advocate yourself. We have so many nurses and doctors that come in, and even the PAs and MPs that I've worked with, I asked like, what they know about this. In those type of schools, they touch on it for like maybe half a lecture, and that's it. Not how to manage it, not how to properly diagnose, how to keep everything balanced when you're at testosterone and estrogen, how do you get that balance and how do we make it work? The biggest thing is you have to advocate for yourself on there. But that means we as men have to be vulnerable and say, hey, I'm having these issues. I am having libido issues. I am not feeling good. Can you test these? But men still don't want to admit that. That means there's something wrong with them. You as men don't want that. That's where the vulnerability comes in. And that's where the accountability comes in, where you can talk. Again, I talk to my buddies, like on a group chat still for my friends back in Wisconsin. I've had half the group message me personally to ask, like what they can do, because we don't have any of our clinics there. And it's like, hey, if you go somewhere, see what they have to say, and then come talk to me, I'll help you. While the other group are still just making fun at the time. And the thing is, I know 3 of them that are probably need it. Maybe because they're dicks, but sorry for my French. But so those are little type of stories, and at the end of the day, what we do is we just spread awareness, and we just want to have that balance. There's a big difference of those that are doing it from a pure anabolic standpoint for stage, where they're doing it unsafe, unregulatory levels, into what we do and what we try to promote that people are getting from their doctors. We've had people come to us because they are fully mismanaged by their doctors. It's not to the doctor's fault. They just don't know. We've just been around for so long that we were able to really dial it in. Because there's so many applications how you can increase testosterone levels. Shots, pellets, oral, creams, you know? So our job is to spread awareness and figure out what the gold standard is for each person individually, because everyone is different. It affects everyone differently, and we just want to make sure that everyone can be their optimal self. Now, we do have our PA Rise here, so if there are any more clinical questions, if you want to know the history, like, hey, how does it work, how did it come to be, and everything, but I'll open the floor if you have more questions right now. Or if there's any like particular stories, or how it can help, how many people, etc. Yes?
More on the biochemistry side of things. If this is bioidentical hormones, or this is...
All right, I'm gonna speak as loud as Joey, somebody's...
So, is it more bioidentical hormones, or this is pharmaceutical man-made?
So that's an interesting question, right? So as the PA, Joey's a great like face of the company. He goes out and he meets everybody. I mean, he's amazing. And then they come into me and then they'll ask me the questions and whatnot. I get a lot of those questions. Like they say, patients will tell me, hey, I don't want to do this because it's not natural. The only real natural testosterone would be us harvesting it from a cadaver or someone who's alive. That's just not something that's done, right? That's not a real thing. There are natural forms, the testosterone that are pharmaceutically available. natural. They're precursors from soybeans and natural yams. And then they're synthesized with other medications. So they are natural and synthetic. So there is no real like natural testosterone out there. But good question. I get asked that a lot. You know, people ask like, hey, is it a synthetic? Yes and no. And if anyone tells you that they're taking a natural testosterone, they're lying to you.
I know that you mentioned 2007, it was noted that decrease in testosterone levels. Is there any like factors that have been contributing to the kind of a decrease, or has it just kind of been as long as humans have been around sort of thing?
There's a lot of studies that show that men in the 1940s had more testosterone than men today. Why is that? You know, I call testosterone the Goldilocks hormone because if life's too hot or too cold, testosterone goes down. Right? Testosterone at the end of the day is an anabolic hormone. Let's take working out for instance, right? Anabolic just means growth. So if you're not working out, you're not sending a signal to your hypothalamus telling your anterior pituitary hormone to shoot down a hormone to make your testosterone release. So testosterone goes down. If you work out too much, it eats up your testosterone. If you're not sleeping well, your testosterone goes down. Now, I believe that in the 1940s, right, when the sun went down, we went down. Now today, our second shift, right? The sun goes down, we get in our phones, we go to work, and life keeps going, it keeps on. So I think a lot of external and internal factors are, you know, and probably the foods that we eat as well. I doubt that the foods that we're eating today are as natural or as organic as the food in the 1940s. They're injected with hormones, with antibiotics and whatnot, all bringing down our testosterone. So that is like kind of just a general trend, just in nature or external factors, I think.
Yeah, I've heard plastics, microplastics also
Mhm.
contribute. So I had a question though, so I was talking to you guys earlier, my husband has all of these symptoms and, but we're up in Seattle. So might be interesting to have him come down here, but what's the process and would it even make sense for somebody from Seattle to?
No, absolutely. And the biggest thing is, we've had people who have been with us and they move out of state, and I try to help them. I go on Google, I try to find the right place to send them to. Do the evaluation and then call us. Make sure that they are legit, first off, what they are tested for in their lab protocols. You know, so yeah, ideally if he's ever in town, stop on by, we'll do the full panel and kind of what a standing orders would look like, and you can take it to another clinic and they can take over treatment and care as well. But I know we've had other places where we send them, they call us and say, hey, can you explain a little bit more about this protocol? Because they didn't know. So when people do go, it's like, hey, I have no problem getting on the phone and be like, hey, let's see if this is actually the legit one or not. Like for instance, we have competitors that they look at testosterone levels, but they're not looking at PSA. They're not looking at hemoglobin, they're not looking at estrogen, which are the four main things that we have to look at to make sure that there's nothing wrong. So if your PSA is way too high, it might be a urology issue that we have to send you to. If your testosterone is too low, it could be prolactin, FSH, LH, and that's what all of our protocols look at. So it's like, hey, this might not actually be beneficial to you. You need to go see urology instead. We've actually been able to really help people catch problems earlier with our protocols that we have. So if you go somewhere like, hey, my testosterone is this, but what is this? We had another person that advocated for his testosterone levels through his doctor. The doctor only put the testosterone, not the other things either. So you really have to know what to ask for and everything at that time. So if he goes somewhere in Seattle, totally fine, but you have our card, like,
Yeah, well,
yeah,
my daughter's down
yeah,
here,
just-
she's come down here pretty often.
oh yeah, and come on down, just pop on in.
Yeah.
Just name drop this and we do a free eval.
Okay.
Yeah, so we're offering free blood work as well. And then, actually, before another question, you brought up a point that I forgot to mention, and kind of wanted to bring up earlier, is if you work out too much, you can deplete your testosterone. That was the craziest thing to think about. That's another reason why I didn't think I had low testosterone. Like, even I could squat 500, bench 4, deadlift 5. Like, I'm not weak. I can't have low testosterone. But if you were to see the people that come in, a lot of them are jiu-jitsu people. There are a lot of people that are completely active, that do a lot of working out, and they need it more because they use it more. So that was one of the craziest things I learned about, like, being in this process. Like, yeah, The more active you are, chances are you might actually need it more than those that aren't. So it's like a double-edged sword. I'm like, oh, I did do this to myself. Totally fine though, because we can fix it.
So the athletes are prone to that?
They can be, yes. Especially like, let's use collegiate athletes. They have to wake up early in the morning, work out. That's cool all day. Probably a part-time job in the evening, studying at night. Lack of sleep, constantly going and working out, high stress. And that's why, for instance, I get phone calls all the time, or I do tabling, so like at local gyms. Like, well, I don't need that, only this age. I'm like, how do you know? If you don't need it, that's cool, that's good. But you should at least get a baseline though. Like back when I was in my competing days, 24, 25, if I knew what I knew now, 1,000,000%, I would want that baseline on there. And something to like just keep monitoring. Because if I knew I was lower then, what could I have done differently to increase my levels, like naturally? What habits could I have changed to one, help my performance, but two, just know me. And then just figure out from 1 month to 6 months out, like if there's a significant change, what happened? Again, I have a science degree, so I love the studying on everything. I love the stats, I love looking at data and figuring out patterns. So I wish I did that. So when people come to me at the gyms and they're asking, I don't need this, like, good, so should know though.
I agree with that wholeheartedly. Like, I'm at the age now where I'm getting my hormones done and I'm doing the bioidentical. And, like the lady, I mean, it's like you say, that they know the ones to test that your doctor doesn't know. It's like all different ones. You know, whereas your doctor is just gonna be like, oh, one estrogen, but it's like all these different ones. And then I wish that I had had it tested like when I was in my 20s, like in my prime, because I know like my levels were like, then if I would have known what they were in my 20s, like she would have a better time now, like knowing what
Yeah,
put me at, you know,
exactly.
kind of got me back to like my norm.
And that's, everyone's different as well, and then
Yeah,
we lose,
I know,
especially the
it's
women's
different.
health, so that's why I'm happy that's getting increased as well. Yes,
So is the treatment expensive conventional wise? Because I don't think insurance does help with this, or I might be wrong.
so many clinics do not, unfortunately, go through insurance. Like, you would have to go through your primary, luckily, for insurance. Like, we accept some insurances, but you have to go through so many hoops. Like, you have to have 2 lab draws before 10 a.m. It has to be under a certain level. We had one person that was 1 point over, can't use it. And the range for testosterone levels is 264 to 912. Guess what, you're right here. Oh, technically you're not low, like, you're really, really low. You know, so like, we have people come in and they're at low 300s, like 303, 304. Went to their doctor, doc, I feel like crap. It's like, yeah, but you're fine. The blood says you're fine. You're fine. It's like you go to a doctor and say, my back hurts. Your MRI says you're fine. You can't just say someone's not in pain. You can't say someone doesn't feel good just because a test says. Everyone is completely different. So, in terms of the insurance, no, you would have to go to primary, but finding the primaries too, like do that, especially for women. Testosterone, you will not find in any clinic that does cover testosterone for women, sadly. And we're like the only clinic still around that does insurance for men. And even then, it's like, if you come in trying to go through insurance, 95% of the time, it's not gonna take. Great question. Yes?
So, you know, we're in a different time, and so what about people that are transitioning? So,
Yeah.
you know, female to male.
Absolutely, and actually, we have a sister company called Identity. So we have a subset that they focus solely on that. That is, we actually did a Pride event, and they took over because I don't know anything about that, unfortunately. But yeah, so we actually have a sister company that specializes in that. But otherwise, I don't really know.
That is a really good question, right? There is that subset of population where they do need that help. Again, we specialize, I feel like we dominate when it comes to like, hey, how to dial in males and females testosterone. And we have, as Joey said, that sister company who dominated how to help that specific population as well. A lot of what we do, I feel like Joey's and our job is just like dispel a lot of like misconceptions when it comes to testosterone, right? I'm lucky enough where I get patients in the room by themselves and almost like tears in their eyes, you know, they're saying, hey, I don't know what happened. There's a switch that was flipped. I don't feel myself, I don't feel right, like, and 9 times out of 10, what I don't hear is libido, you know, and it's funny, right? You say testosterone, people automatically think, and we go to a lot of events and people say, oh no, my husband doesn't need any more libido, or he's not trying to get in the gym. It's like, oh, 9 times out of 10, it's, I just don't feel myself, right? Or I feel like I'm lucky enough where I do get to see them vulnerable. And then I'm lucky enough to see them after we balance their hormones. Hey, I just feel great. Like, I don't know, my sleep is better, my mental state is better. We had a 71-year-old patient his wife called us, and she was like, hey, I just wanted to thank you guys for like giving my husband his life back. And that's 71, you know, and I just feel like, are we here for just quantity of years, or do we want like quality of years? And hormones play a huge role in that. It's like us being embarrassed to say that we have type 1 diabetes, that our pancreas doesn't work, or my thyroid doesn't work. You know, there's no shame in that. There shouldn't be any shame in males saying, hey, there's something going on with my body, I'm not producing enough testosterone, I'm imbalance.
And from onset of treatment to results, because we know, 15, 20 days for an antidepressant to kick in, what is it with hormones?
It's gonna be very like patient specific variant. Can't really give you like a guarantee. Typically what I hear about 3 to 4 months, people notice a major difference.
A lot of these factors seem pretty qualitative, and it's like, one person's lack of energy might be adequate for another. Are there any clinical flags that can kind of back up your feelings and what you're feeling? Like, are there things like blood pressure, or, if you get those flagged on your annual physical, that's kind of like support that, hey, maybe you need to go get tested?
For testosterone, not really, to be honest. There isn't gonna be any like major, like, oh, this is low, this might be low. Prolactin levels, that's one, actually, that's probably one of the few. There's a tumor that you can get on your pituitary gland, and if it's secreting a ton of prolactin, it's gonna inhibit the production of testosterone. But outside of that, there isn't really like an indicator.
That's just kind of a subset of the factors that we need.
Correct,
Okay.
And what we do here, not all of our patients or prospective patients get on treatment. We run full panels, we look at their thyroid, we look at their vitamin D levels, we look at all these different hormones, and we say, hey, if your testosterone's fine, or if it's borderline, maybe we should focus on these things instead before we put you on testosterone. Just at least tell you what you can do naturally before you commit to something like TRT.
A lot of people say that we BS when we go places. It's like, free labs? What's the catch? Literally nothing. I'm paid either way. I just want to spread awareness on it. I know it's how it's helped me. So many people, again, before in the gym life, I wanted to be like sports medicine field, like either physical therapy, or then I switched to that, one-on-one personal training, just because I love people. I like communicating with people. I never gave them things that they didn't need and everything. So I know how it can help me, and our guys, even girls, are saying how it's changed their life for the better. It's like, listen, I can just lead the horse to water, not drink. I'm as transparent as you're gonna get.
Just a quick question, after you start a protocol, this is lifetime?
So this is where we can debate. This can be a debate. So from a clinical standpoint, they say yes. That if you start, then you have to be on it, otherwise you'll go down the baseline. However, in my years being here, I have seen so many times where people had to keep decreasing their dose. Because again, we're just trying to get balance. If you're too high, that can have the same negative side effects as being low. Where we keep having to decrease their dose because they just keep running high. It's like, hey, you probably don't need this anymore. He came back 3 months later, and from his last set of labs, yeah, a little decreased, but not to what his baseline was.
As we balance men's hormones and females, right, the machine runs better. People start sleeping better, they start eating better, they start taking care of themselves. And so, yeah, so as like everything else starts to balance out, we find out with recurrent blood work that the dose we're giving them is too high, so we keep decreasing. It comes to a point where sometimes they drop off, they'll come back a few months later, and they're somewhat a little higher than when they started, and they feel good then.
This has such like an amazing opportunity for research, all that qualitative and quantitative data into this massive research. I was like,
This company's been around for 17 years, there's roughly 80 clinics throughout the nation, male, females, and identity. So, correct, there's not a lot of companies out there who are really just solely focusing on testosterone and how it helps and benefits people, so, I feel like Joey said earlier, a lot of these doctors where they put guys on testosterone, maybe they're missing something here and there. To their credit, they just don't have a big team like we do, that I have 80 different clinical directors, I can ask them a question and say, hey, what are you guys doing? I'm seeing this is weird, how can we better fix this? So, you guys have been awesome.
Yeah, thank you.
Thank you.
This is fun.
Another round of applause.